Hello all, and welcome to my presentation of my final report on the quality improvement study, of which the topic is evaluating the effectiveness of teaching and utilizing distraction for sickle cell pain in an acute pain setting. I am Patricia Chapman Kelly and a DNP student at Maryville University. I have the pleasure of introducing my committee, my chair, Dr. Tanya Crystal, my second reader, Dr. Rachel Davis Citron, the DMP site preceptor, Dr. Sally Walton, and my community member, Dr. Andrea Bundy. For some background, sickle cell disease pain or vaso-occlusive crisis, VOC, is challenging to treat due to the incapacitating pain, in addition to other high-risk adverse cardiopulmonary and cerebrovascular events and an organ damage. VOC, the leading cause of hospitalization in this population, incurs high healthcare costs. The main therapy has been opioids, analgesics such as NSAIDs, and nerve pain interventions that cause increased risks to organs. The current opioid crisis intensifies these risks. Across the literature, non-pharmacologic pain management therapy has had evidence-based proven efficacy and is recommended by oversight committees such as the American Society of Hematology and the Joint Commission. According to the Joint Commission, an effective pain management plan depends on accurate pain screening and assessment. Butt et al. Endorsed the use of distraction techniques using television and playing games in the pediatric population in relieving pain and anxiety, thus decreasing the use of anxiolytics and opioids. So the significance to this project is that at a university hospital in the Midwest region of the United States, a gap in care is identified where patients' use of distraction activities is not acknowledged, assessed, or documented despite the NPPM methods being available in the EMR. Distraction activities are easy to perform and readily available, and are often already being performed by the patients upon presenting for their pain management at the acute pain setting, or sometimes, most often, being performed at home. Mark et al. Cited in John Baptiste regarded nurses among the healthcare providers who play a significant role in advocating for sickle cell disease patients and communicating their needs. And again in Henley, they emphasize the impact of health and illness on quality of life, with a focus on critical communication between healthcare providers and patients. Diddick and Grand did warn that there are long-term implications for our patients' mortality and morbidity in how their pain is assessed. So the purpose of the study is to increase patients' distraction use and nurses' assessment and documentation in the EMR. Additionally, the significance of this project to nursing practice comes from the tenets of our nursing profession. Nursing responds positively to scientific knowledge and uses EBP and theoretical models to inform practice. This is from Raffi et al. And they should practice without bias. Reeve states that empirical reasoning is part of the construct that comprises EBP. Chin and Kramer affirm that personal knowing involves knowing the self in relation to others, citing Barbara Carper, 1978, who states, "One does not know about the self. One simply strives to know the self." Aesthetic knowing deals with nursing care with empathy, while ethical knowing is having a sense of right and wrong in nursing practice. Emancipatory knowing is being aware of the culture that exists at all levels, micro and macro, and performing within it for the good of the patient to dispel stereotypes and myths that cause barriers to care. In this literature review, search terms such as sickle cell disease, VOC, distraction, non-pharmacological pain management, nursing pain assessment, and documentation were entered in varying rotations using the advanced search tool. I also applied the Boolean operators and set the limits such as year to year, full text, and peer-reviewed. of which 19 possible research articles were obtained. 14 articles relevant to the project were then assessed and used in this literature review. These included one randomized trial, several systematic reviews, cohort studies, and a case study. During the search, some emerging themes were recognized, 4 of which were influential in guiding the project. One was need for alternative pain management. Then there was nursing knowledge and attitudes. The third, feasibility and availability of non-pharmacological pain methods. And last was functionality and ease of distraction in pain assessment and management. These were addressed in this presentation. While critiquing the literature, I found an overwhelming and conclusive conviction that this topic is essential to practice. These factors are considered in the literature critique and inform the DNP project. Deaton and Cartwright expressed that strengths in the literature are bolstered by randomized controlled trials, although there were not many of those for this DNP study. There were some random sampling designs in some research articles. And as far as weaknesses, they were identified in some studies by the authors Jakub et al., such as small sample size and using scoping reviews, which is a weaker study. Limitations, despite the positive and encouraging results. Some authors found limitations in what they could use as distraction techniques due to cost and availability. Also, the arrival of the COVID pandemic that limited interactions and possible investigator bias. Some stated the use of surveys were not validated outside of their investigation. White et al. Describe a conceptual framework as a guide for empirical inquiry, outlining key concepts related to the clinical question. So for my theoretical framework, the theory that stood out is Rigel et al.'s middle range theory of self-care for chronic illness. And since sickle cell disease is a chronic illness marked by frequent and unpredictable incapacitating pain, the key concept applied here. Those were self-maintenance, self-monitoring, and self-management. Distraction techniques allow patients to manage their pain independently, giving them autonomy and enabling less opioid use. For my method, this is a QI study that commenced with an initial review of 4 weeks pain assessment documentation of distraction methods used and whether they were incorporated in the patient's pain assessment section of the EMR. This was followed by the interventions, which are the education materials. The pain clinic nurses received their pain management tip sheets, which are the institution provided instructions on providing pain therapy, which outline the expectations. And the patient teaching distraction flyer was created by this private investigator and approved by the department hematologist, then was vetted by the university's health literacy department. The patient teaching flyers were provided to the nurses to distribute to the patients upon their arrival at the pain center for sickle cell pain management. Jakub et al. Purport that improving healthcare providers' knowledge and enhancing their positive attitudes towards sickle cell disease patients is essential for delivering high-quality care. The documentation data from the weeks preceding and following education would determine the statistical significance of any change in patients' distraction use, nursing assessment, and documentation. The study design is a quantitative, retrospective, non-experimental design which includes a retrospective chart review over 12 weeks. The target population is sickle cell disease patients with pain crisis arriving to the pain treatment center seeking pain management. Study participants were the nursing documentation data to be collected from patients' EMR. This data was then transcribed onto the PI-devised data collection sheet, reflecting each chart identified numerically and listed by the encounter dates. No patients were approached or engaged for the study, therefore no IRB was required. Sample determination came from the knowledge that sickle cell disease affects primarily African Americans with consideration of their social determinants of health. Approximately 10 to 20 sickle cell pain-related visits are managed weekly in this department at the DNP site, at which an anticipated 50 patients chart were expected to be reviewed pre-intervention and 50 charts post-intervention between May 1st, 2025 and July 31st, 2025. It was a convenient sampling project, and the inclusion and exclusion criteria were applied as follows. They were to be English-speaking, cognitive, with no other adverse complaints such as acute chest or chest pain, as these required a change in overall management. The EPIC drop-down for distraction methods as management and assessment is required, and patients should be between the ages of 18 to 89 years old. So for data analysis, the identified data from the EMR were imported into the data collection sheet, representing in a 1 for yes and a 0 for no format, indicating whether pain assessment and documentation were performed. The data collection spanned from the first to the last date of collection, analyzing a total of 136 participants, including both pre- and post-intervention groups. Data from the collection sheets were then exported to Microsoft Excel for statistical analysis. The z-test for the difference of two proportions, a directional form of a chi-square test, were the tests used. The z-test is a hypothesis test that would decide if there was an increase in the use, assessment, and documentation of distraction methods within the sample after the intervention. The chi-square test was used to determine whether there was a statistically significant difference between the pre- and post-intervention groups, determining whether to reject the null hypothesis. So these pie charts were generated to demonstrate the analysis, showing the results from the pre-intervention to the post-intervention data collection over the 12-week implementation. In the pre-intervention analysis, no documentation of distractions were found in the 42 EMRs examined. That is demonstrated here in a 0 out of 42. However, in the post-intervention EMRs, distractions were utilized, assessed, and documented in 26 of 94 charts, also demonstrated here in the post-intervention pie chart. To further illustrate my results, as seen here in Table 1, that of the 136 EMR data collected, which exceeded the 100 samples needed for a power of 0.8, nursing distraction documentation post-intervention, 26 of 94 expressed a difference of 0.27659 from the pre-intervention sample of 0 out of 42 charts, and an average proportion of 0.1912. A p-value of less than 0.0001 was statistically less than the significance level of 0.05. Now, Table 2 demonstrates a positive direction of change, allowing for rejection of the null hypothesis with a confidence level of 0.05. The critical z-value of 1.6449 is statistically significant. The study achieved a power of 0.9997, which is considered high in terms of statistical strength. And as far as limitations, due to the IRB waiver, patients could not be approached or surveyed during the project, preventing any determination of their perspective or whether they understood the education and its impact on their care. The nursing tip sheets and the flyers were not considered in the descriptive statistics or the results, suggesting no direct correlation to the increase in the documentation. The flyer distribution data relied also on the nurse's report or just an assumption that that part of the intervention had been met. and the numerical pain scale information was available, but it was not utilized because of the study's focus, which was on the EMR data and not on pain management. There were missing data also due to busy workflows. Rotating nurses were unfamiliar with the project, and they would rotate to the unit and were not participating as expected in the charting. And some nurses also who were involved were charting in the progress notes and not on the epic drop down, which was part of the inclusion criteria. Another limitation was that the sample size would have been more productive if it was a larger sample size and also a longer time frame for implementation. One last and very important point was that patients were wary of using distraction due to fear of not receiving immediate relief with opioids or other analgesics. So in this discussion, I will point out related studies found positive results for distraction as a safe and effective option and agreed that nurses' attitudes and knowledge may be more improved. Most of the researchers reported positive findings for the use of NPPM, and particularly distraction, necessitating patient and nurse education, which is comparable to the DNP study, although the authors' focus were more on the aspect of pain improvement. There were other variables, as in comparable studies, were not considered in this DNP project, which may have provided further insights into how the patient responds both physiologically and psychosocially to healthcare provider acknowledgement and provision of distraction use. The study's strength enhanced the results of the studies from the nursing engagement, the validated intervention tools such as tip sheets and distraction flyer, or stakeholder involvement and approval, and also the available EPIC documentation tool. The project's implication for practice are substantial. The distraction techniques and NPPM method can provide an adjunctive pain therapy that decreases pain in the clinic or emergency room setting for patients with sickle cell disease. Based on the results of the DNP project, education for both nurses and patients will increase nurses' assessment and documentation of distraction methods. Other benefits are the decrease in opioid overprescribing tendencies as providers encourage distraction techniques to enhance self-management and self-maintenance at home. Based on medical association mandates for multimodal approach to pain management, institutions that incorporate distraction techniques into their pain management plans would be practicing according to evidence-based guidelines. At this point, I want to add my timeline of intervention as I find it a most potent demonstration of the work that was put into this project and its progress over time from Chapter 1, the planning phase, to Chapter 5, summarizing the results. So in conclusion, while the DNP study involved nursing documentation and assessment to enable patients' use of distraction techniques, education on both sides is an integral part of the adoption process. Nursing attitudes to practice are enhanced by evidence, promoting adherence and compliance with standards of care. Notwithstanding the study's limitation of sample size and time frame, the study's significance is undeniable, leaving room for future larger scale studies that may also include more patient responses to the methods and satisfaction with their treatments while under the care of healthcare providers for pain management using the distraction methods. Practice sustainability is possible with the recommendations for enhancements, including yearly nursing competencies. Sharing the study results from the DNP study with the DNP site research committee, department leadership in the form of a presentation or through a project poster or in collaboration with group meetings is a significant step in disseminating the project's success and promoting its adoption into practice. Thank you for your attention to my presentation of this final report and following along with me as I share my experience in implementing the quality improvement study. Here are my references